Welcome back to Gene Therapy, a whole new world. It's your girl Hannah, and wow, this season has taken us deep into what gene therapy really means. Not just as a medical breakthrough, but as life-changing reality for people with hemophilia. Throughout this series, we've heard from patients who took leaps of faith, clinicians who guided them, and researchers who were pushing the boundaries of what's possible. As we wrap up this season, we're excited to catch up with our guests, patients like Terence, Chip, and Greg, and Dominic, family advocates like Brianna, and of course our experts like Dr. Lemons and Dr. Marquet, as they reflect on the long-term impact of gene therapy and look towards the future. Together, these stories really remind us that gene therapy isn't about science. It's about trust. It's about hope. It's about patience and reimagining what's really possible. Before we dive in, here's a quick word from our sponsor. It's a whole new world gene therapy segment brought to you by CSL Behring and their Hemophilia B gene therapy treatment. To learn more about gene therapy, hear patient stories, and view additional support resources, visit beyondhemb.com or download B Support wherever you get your apps for more information and to manage your treatment journey. Gene therapy didn't happen overnight. It took decades of research, setbacks, and persistence from scientists, and courage from patients willing to try something new before outcomes were really guaranteed.
When I started in the field, the concept of gene therapy was relatively simple, and there were a lot of promises made that weren't fulfilled because it turns out there were a lot of technical barriers, some of which at the time it wasn't clear, obvious how to try to study that to get around some of these barriers. But over time, over the last few decades, a number of achievements have been made. We made contributions, many others, that have really pushed the field forward where it's become something that has gained a lot of respect.
And in November of 2022, that persistence, well, it led to the FDA approval of gene therapy for adult males with hemophilia B. And that really opened a door to many people who have been waiting a lifetime to see this.
It's a personal decision for every patient with hemophilia. And the FDA label is quite interesting. It says that it's a single one-time infusion for adult males with hemophilia B who either are on routine factor IX prophylaxis or someone who may have had a life-threatening current or historic bleeding episode, or someone who's had repeated serious bleeding episodes over time. It doesn't specify severity of disease, so it doesn't specify you have to be severe or moderate or even mild. It doesn't specify you have to have a specific factor IX baseline level in order to be eligible. So really anyone with hemophilia B, adult male, 18 years of age and older, who is on routine factor IX prophylaxis is potentially eligible to receive this.
Behind every breakthrough is a person who has to decide whether to trust it. And for Terence, gene therapy wasn't about convenience, it was about trust.
I was on the traditional half-life therapy and the extended half-life therapy. So on the traditional side of things, a day-to-day really depended on how physically active I was going to be that day or, the following days. So you decide, okay, if you're going to be very active, I need to make sure to infuse either beforehand or afterwards. It came in waves often because throughout my journey, I had these random one-off spontaneous bleeds that would often shake my confidence in my therapy. And during my process of convincing myself for gene therapy, I had to look back on those moments and say, okay, is my condition really in check? Is it really managed properly? Because I'm still having these sometimes ridiculous breakthrough bleeds, and it's winding me up in the hospital. So clearly, something's not working correctly.
For those whose gene therapy was successful, daily life changed profoundly. No more routine infusions, no more constant calculation of risk. Life could feel freer. And up to this point, we've heard what gene therapy feels like, but for something this big, Trust also comes from knowing what happens over time. With something this powerful, hope always comes with a question: does it last? And to answer that question, we're going to turn to Dr. Lemons, who has been following the Hope B trial for years.
So the durability and sustainability of that factor 9 level and really the high, mild, normal range for the mean value is quite remarkable. And it's particularly significant since this is a once in your lifetime treatment. It's a single IV infusion in the outpatient setting. And the fact that this has now remained durable and stable consistently over that 4-year period with a very favorable safety profile.
The 5-year Hope B results are more than promising. Bleeds are down, factor 9 use is down to 96% levels, and they have stayed steady. Safety remains strong. Even participants with pre existing antibodies responded well, and most stayed in long term follow up. For patients, that means fewer infusions and a more predictable life.
I'm a science nerd through and through, and the first thing that I noticed in the Hope B trial was that the numbers were pretty low involvement wise. But I had to really think about it. Well, hemophilia as a whole is a rare condition, so finding people to even sign up for these trials might be pretty difficult. So, in all, representation was kind of what I was looking for through and through, and that was difficult to get. I'd say that there's plenty of resources out there to reach out. This is not a decision that you have to go through alone, even if you don't have, friends and family that can be your sounding board.
Patients aren't losing their activity. They're not seeing their levels drop from 40% to 30 to 20 to 10, and then going back on prophylaxis at year 4 or 5. The fact that these levels are durable and sustainable and constant without any apparent late effects so far, that patients are doing well with not suffering. There have been no late effects of liver damage or liver toxicity or renal damage. The patients haven't really had any serious adverse events from this clinical trial. So it's really a plus win.
And for patients like Terence, those numbers aren't just data, they translate into something tangible: more freedom, more confidence, and a life less ruled by infusions.
I almost feel superhuman because this is something unnatural for me. I'm still coming to terms with not needing to infuse every other week. I still have the calendar reminders that says, "Hey, take your factor." And now I get to, swipe away and say, "Nope, don't need to do that." Now I don't need to really plan for those rigorous activity days like I used to. I'm an active dancer, so my target joints are absolutely relieved from all of the microbleeds that I was having in the past. Um, and I'm not having microbleeds when I do have very rigorous days. So it's been absolutely delightful.
Terence's experience is one way gene therapy can change a life. For some families, the decision and its impact experienced from the outside, watching someone you love take that leap. For Brianna, that means seeing her son weigh whether gene therapy was right for him.
It's a big release off your shoulders. Like you could take a deep breath in, knowing it's one less thing that I don't have to sit here and stress about every day. And then just to be proud of him, because it wasn't easy. Like, and we knew that, like, when he had to make this decision that, yeah, you're a 20 year old kid in college. We all knew what they do in college. We had this talk. This was because this was one of his concerns when he thought about doing the gene therapy. He was just like, well, what if it doesn't work? And then I can't ever get anything again. And so that was a conversation we had. We said, well, I said to him, I said, well, we waited 18 years for this. I said, so medicine changes every day. Like, they're constantly working on things in every medical aspect of the world. So who's to say that if this one doesn't work, that in 10, 15 years, that there won't be another one?
After I got gene therapy, my doctor thought that I would have to infuse for at least 1 or 2 more weeks. But after we got my first results back, I didn't have to infuse at all. My doctor made the decision to just stop my infusion. So pretty much right off the bat, right after getting gene therapy, my infusion stopped. And it's been a year. It's been a year and some change now since I've infused.
Durability doesn't change the data, it changes how patients imagine their future. Some have needle phobias, some don't, but every infusion avoided is one small victory and a part of life that's quietly returned to that patient.
Because I have not had to have factor since then on a regular basis or any factor, I have over 280 times now had not had to give myself anything. So that's 280 times that back of this hand right here hasn't been poked.
Fewer infusions don't just reduce the burden, they restore parts of life. And even today, patients understand this is part of a longer story. Science is ever evolving. While gene therapy is a one time treatment, future advances may offer new options for those who've already received it.
I'd say you kind of have to let science play its part. Science is a ever evolving beast. While yes, gene therapy is a one-time treatment, and because of the way it works, that means you're not eligible for gene therapy in the future. We're kind of in this science meets fantasy situation. So just like technology, it's going to catch up one day in the future. And hopefully, there'll be a treatment option for people who have gone through gene therapy.
This scientific confidence, well, it allows patients and families to plan for the future with a new level of certainty. For some, gene therapy is the culmination of a lifetime of waiting, dreaming, and hoping, a moment that feels almost miraculous.
It just seemed like something out of a dream. And the doctors fully understood what they were doing. And I realized what almost a miracle this was. And the fact that it worked so well was just literally something that I never expected in my lifetime to get a chance to enjoy.
And what makes this even more powerful is this isn't the end of a story, it's the beginning of a much bigger one. Lessons learned and successes achieved, well, they are shaping possibilities for other rare and genetic conditions. Gene therapy is no longer just a promise, it's real, it's happening, and it's already changing lives. Through the voices of the patients, the clinicians, and the researchers, we've seen what's possible. And when science is matched with trust and hope, progress, well, it doesn't happen overnight, but it does happen when people believe in something bigger than what exists today. Thank you for being a part of Gene Therapy, A Whole New World. This series, well, it may be ending, but the story of gene therapy is just beginning. And the future it points towards is brighter, bolder, and full of possibilities. Well, as always, it's your girl Hannah, and we're signing off. Take care, y'all.